Now, Kenya will need at least 5,000 more healthcare workers to effectively deal with the COVID-19 pandemic. The Kenya Medical Practitioners, Pharmacists and Dentists Union wants the president to increase his budget for hiring these additional personnel to 5 billion shillings. Just how many more doctors and nurses does Kenya need to employ for this crisis?
Scholars studying the trend of this virus globally have noticed that it takes about 3 weeks for cases to transmit locally at a high rate. In Italy, 3 weeks was what it took for positive cases to jump from 3 to 229. Today, Italy has 74,386 active COVID-19 cases. And this is why this directive by the president is perhaps one of the most important and time-sensitive for Kenya.
Kenya shillings 1 billion from the Universal Health Coverage Kitty be immediately appropriated strictly towards the recruitment of additional health workers.
Healthcare practitioners are already crunching the numbers and dusting off files of potential doctors and nurses to be hired.
We have to employ additional 1,000 doctors, additional 3,000 nurses, additional 500 lab practitioners, additional 500 psychologists, and then the other cadres you can cascade depending on need. But the minimum number we need is around 5,000. So the 1 billion is really good, but it is not enough. In fact, I doubt we were doing the projections yesterday. The 1 billion, what we see it doing is that we at least at the very, very minimum with the 1 billion alone, we want 348 doctors employed, 348 doctors employed, 1,000 nurses employed, 270 clinical officers employed, around an average of 380 lab technicians employed.
KMPDU says an additional 4 billion Kenya shillings will be needed to hire the minimum number of practitioners required in this crisis.
For one patient, 7 doctors come into isolation. You first of all are dealing with a shortage. So, and then you remove these 7 doctors from the hospital. That means that the patients lack 7 doctors. So you have to replace the 7 doctors. But beyond that, there is this additional cases of coronavirus that also require an expanded health workforce.
Other doctors like Dr. Lois Ombajo believe that the weakest link in the fight against the new coronavirus may not entirely be our healthcare system.
Biggest link is probably us, the general population. There are certain recommendations that have been given. If someone has traveled recently, stay at home. Quarantine, initially was saying self-quarantine, now the government has asked for mandatory quarantine to make sure that if you had been exposed out there, you don't expose other people. You don't expose your family and your loved ones and other people. So that's a first thing. Prevention is very key.
The World Health Organization, however, advises that measures such as curfews and movement restrictions, while important, can only buy us time. This is why Kenya will need to learn from countries like Italy and act fast, much faster.
We're not different from any of those other countries. If we had tens of thousands of people infected, our hospital capacity would be stretched. If we had a lot of people requiring critical care, our ICUs would be stretched. So we really have to think about prevention more than anything else.
It has been exactly 2 weeks since Kenya reported her first positive case of the new coronavirus. And with 1 patient already recovered, the task for government is to ensure that as the country enters the third and perhaps most crucial week, the curve of infections will be flattened soon.